I'm Dr. Steve Myers, and I'm here with my patient Catherine, and she's 6 weeks out from bilateral stem cell procedure for bilateral knee arthritis. And before we talk to her, we're going to take a quick look at her x-rays and show you what we're treating with this patient. So looking at her x-rays, this is a standing x-ray of both of her knees. This is her right knee and the left knee over here. If we zoom in and take a look at the right knee, you can see good amount of joint space on the outside of the knee, but narrowing loss of this dark space. That's loss of cartilage thickness in the knee, along with a bone spur on the inside of the knee here, and some spurring on the outside as well. Looking at the left knee, similar picture with significant loss of joint space, loss of cartilage thickness on the inside of the knee, along with a big bone spur on the inside and some spurring on the outside as well, indicating moderate arthritis of both knees. Okay, so thinking back to before the stem cell procedure, describe your symptoms. What kind of trouble were you having with your knees?
When I first came in, I was in so much pain. I was limping. I was barely getting through work. The pain was so excruciating, I was actually crying at times all night long, rubbing my knee. So when I came to you, I had the injections first, and they worked for a little while.
What kind of injections did you have before stem cell? What kind of treatments did you have?
I had the steroid injections.
Okay, and you got some good temporary relief?
I did, for a few months, but it was not as long as I expected it to be, and I wasn't really pain-free the whole time.
And how long have you been having trouble with the knees, by the way?
They've been bad for about 2 years, but
Okay.
They got severe this last 8 months.
Were there activities that you were unable to do because of the knees?
Oh, can't climb stairs, can't bend, kneel down to do any kind of activity like that. It was hard to get around. All I wanted to do is just the minimal daily activity and then go home and get off my legs.
Okay. Going back to the day of the procedure, getting the stem cells, doing the knee injections, how bad was the pain? Was it bad?
No. My pain, I was surprised because I was expecting a little bit more intense pain. It was discomfort. I had mild discomfort.
And then after the procedure, how quickly did you start seeing some benefit with the
Immediately.
procedure?
After I had the procedure, I was pain-free. When I walked out of here, I was not limping. I did have some discomfort. I went home, followed the instructions. But even at home, the expectation of pain afterward was shocking because I didn't have it. I had to take one pain pill, and that was because I was afraid I was going to anticipate pain.
Mm-hmm.
But other than that, I've had no real pain. I've had some discomfort. I've had some tightness from the swelling right after, but other than that, I have no.
So how are you doing now? It's been 6 weeks since procedure. How are you doing now?
I'm awesome. I can go places and do things I couldn't do before. I can walk stairs. I am working without limping, without complaining. I sleep through the night without crying out in pain with my knees. I am so happy. The pain is gone. And I'm so happy that I do not have to have the surgery to have, the knee surgery replacement, the knee replacement surgery. It's been awesome not to be in pain anymore, pain-free.
Are there activities you can do now that you couldn't do before?
Oh, absolutely. I mean, just getting that in and out of the car was painful, going shopping, just daily activity, living, anything that had to do with the bend of the knee, you don't realize how much you use your knee until you're in pain.
Mm-hmm.
You take that for granted, just the little simple, getting in and out of places, or even standing up from a sitting position of a chair, was very painful. So yeah, it's like day and night.
And today, compared to before procedure, 10%, 50%, 80%, 90% better? Put a number on your improvements.
I would say 90%. I would say 90% because I was that bad. I could not get out of a chair without having help up.
So, having been through the procedure and doing well afterwards, do you feel like you made the right decision? Would you do it again?
Absolutely. I tell anybody, jump at it. Yes, absolutely, I'd do it again. If this comes back, if I need another treatment, I will do it again, absolutely. It was so simple and easy. I mean, the procedure itself, it didn't take any time at all. I was in and out, it was in here in the office. The pain was minimal. I mean, I was just a little sore, and I'm pain-free. I mean, I was pain-free, I was so happy.
That's awesome. Well, thank you so much for coming in, and I'm so glad to see you're doing well.
Thank you so much, Dr. Myers. I am just grateful to you for perfecting this procedure. And I tell anybody, please, before you have knee surgery, get this procedure done.
Thank you so much.
You're welcome.